Yeah, let's just one more time go back to these two words, the medical machine, the medical industry, whatever you want to call it. Modern day medicine, hospitals, what's out there, okay? The whole shooting match. As I said earlier, there are some amazing technological advances that's been made to treat all kinds of diseases, not just men's prostate surgery. Just leaps and bounds in the last 10 years is unbelievable. I did notice, though, and this, again, is not a slam on that industry, but as I was going through it, I was at a big, major, if I mentioned their name, you would know them. Everybody in the world has heard of them. They're world renowned in care, hospital care, health care. I was blown away the first time I arrived at their facility. Almost 20-foot wide halls, looked like marble floors, high-end art on the wall, huge. Just the hospital, itself, the physical building, is just so big and so beautiful and so incredible. You begin to think, wow, this has to be the creme de la creme. This has to be the top of the line health care. And sure enough, right off the bat, I was impressed that I didn't hardly sit more than a few minutes in the lobby waiting for my name to be called. Once I checked in, called my name. Hey, Larry, I'm up. And you go in and boom, boom. The people know what they're doing. They got their act together. They take your blood. They take the urine. It's just wham, bam, slick. Now, I come from a little town where you don't get medical care like that. You may sit in the lobby an hour just waiting to hear your name called before anything starts. So I was just totally impressed. And I told my friends, wow, this is medical care at its best. I would tell them, I got in so quick. They did this, they did that. Everybody seems so in tune and smiles and nice. Thank you, sir. We're glad to see you, sir. We're going to take care of you. We got this. I mean, that really, right off the bat, my first impression of them was as high as it could be. And I'm not a particularly gullible, easy to please person. Matter of fact, my daughter even made the comment when I told her about the place. She said, well, just because they got a big fancy building don't mean they're great care. And that's true. And I get that. But here's what happened as time progressed. And believe me, now let me recap. From the date of my diagnosis with prostate cancer, which was late last year of 2024, it was actually Thanksgiving Day. And I started jumping through all the hoops, had to get the biopsy. There was a lot of time involved, and that went pretty smooth. Biopsy went smooth. It was exactly like they said it was going to be. Recovered from that, popped back real quick. They actually call it surgery because they actually go in at the pelvic floor and go in and pull out some samples, but they do it in little tiny holes. I mean, you might have a little discomfort sitting for 2 or 3 days, but it's not a big deal. You don't end up with a catheter hanging on your side with a bag. But they got that information they needed. No big deal. It went real smooth. And then after that, you've got to talk to other people who will contact you, other technicians, other people that are experts in their field to, okay, we need to also now do an MRI or what, we want to check this. We saw a little thing in your back. We want to make sure that's not the spreading of the cancer, that it's maybe just a back injury. They're really covering all bases. So can you come back again? We'll schedule a PET scan or whatever. But be sure that this is not a spreading, that it's just something else. So all that is going on and time is passing and things are still really good as far as my being happy with the follow through of the people that are doing the scheduling and all that. And then I hit, we'll call it the mid-mark, maybe the 3 months in, because I was roughly 6 months from the time I was diagnosed before I was in the operating room. At about that period in time, things began to go kind of silly with people weren't following through from that facility. I would call them, and I would respond to their call or their text saying this and that, and then I'd get a voicemail. I'd leave my name and information, my date of birth, and then I would call back. I wouldn't expect it the same day, but I would expect it maybe the latter part of the next day. I Hope I'm not expecting too much from them. But sometimes 4, 5, 6 days later, I still hadn't heard from them. Have to call again, ring-a-ding-a-ling, or ring their bell. It seemed to get worse and worse. And then they began to do really goofy things, like schedule me for surgery, which means now, and it's like almost a month out, which is great. Plenty of time to change your world, make your plans. I've got 2 dogs. They have to be fed. Someone's got to feed them because I'm going to be gone for at least 7, 8, 9, maybe 10 days. I've got a little sideline business. I'd like to kind of keep that going. I need to try to work somebody to take care of that. I've got things happening in my life. So the people that I have to fall to, as I mentioned, is my wonderful family in most cases and friends. And as I begin to set all that up and my family and friends start making adjustments to their lives so they can be there for me that week, they move their schedule, they change things, they prepare. And I drive all the way to the facility the day before. They call it pre-op. You go one day before and jump through some more hoops before they actually clear you for the real deal, surgery. I actually got to it and was jumping through all the hoops, the blood test, the urine test, this test, that test. I get to the last doctor and she's checking all the boxes, staring into her computer screen. And she got to a point where she said, I don't think you should get this surgery tomorrow. And I go, what? I understand all this prep and everything. We finally got it nailed down to a particular date and time. Well, I'm seeing something here that I'm not real happy with. It kind of increases your chances of not a good outcome. And I'm not going to go into all those details. Let's just leave it at that. Well, the problem was that astounded me, not so much. I appreciate the fact that she had my good fortune and health in mind by saying, I don't think it's a good idea. I think we should wait 30 days. I really appreciate that. What really blows my mind is she had, and the team had all that information at least 45 days before I sat down with her the day before that I was to have the surgery. I actually said to her, I am not upset with you, ma'am. You're a very qualified person, and I know you have my health outcome at your heart, and you want to do it and make the right decision for me. I love that. I said, but why am I being told this the day before? That is so weird to me that I fell through the cracks like that I drove all the way over here, almost 300 miles. I changed my life around. I have all these things set up with other people and family members that are involved in this. And now you're telling me the day before, I think we better wait. Because that information you're looking at, that you based that opinion on, you had a long time ago. And they did. I'm not trying to make this a big drama, but they did. They had it. Well, she apologized, but didn't change anything. I had to start calling people, family members. Hey, it's been canceled. I'm not getting it tomorrow. What? They would say. I had to tell them. Got in my vehicle, made the 250-mile drive back home, tried to crank my life back up, put things back on hold. And they said, we'll call you in a few days and reschedule another date that's about 30 days out. Okay. Well, yeah, I was totally disappointed and I was totally aggravated. Right on the verge of being angry. But at some point you have to get over there and say, well, you know what? It is what it is. Getting upset, kicking the cat ain't going to change nothing. That's just my humor. I'd never kick a cat. You just finally reach a point where you say, okay, go with it, deal with it. It's behind you. There's nothing you can do about it. And I did. And my family did. So to make this even a little more in depth, more calls began, more texting began, more back and forth began. And every time I dealt with one of those people to try to reschedule, one person would tell me one thing. I think it was nailed down. And then maybe within 24 hours, I'd get a call from another person and it'd be totally different. And I'd go, wait a second, this person said this. Well, we can't do that. We got to do this. And it's now this. Okay. You sure this is it? Final answer? Yeah, okay, Larry, this one, yeah. It just kept getting screwed up. I'm serious. I'm not even going to go into all the details. The whole point of this is, and it's not to blast the medical machine and medical industry, it's just to say, my opinion is they do have this incredible technology that is off the chain, no doubt. It's all there. And like I said earlier, I had total confidence in my surgeon and that team that was with that surgeon. But what I'm feeling and what I'm finding in that big medical machine is I think that they have gotten so deep and far into that aspect of it, of the big, big, beautiful hospital and the fancy equipment and the great equipment and doctors from all over the world that are world-renowned, which all is wonderful. I think somewhere, for me, my opinion, based on what happened to me, they kind of forgot we're working on people. And we have to have people that deal with people's emotions and people's schedule, people's distance that they have to drive. Let's try to be a little more in tune with that. I think that's kind of been dropped out. And I think that at that level where, and I'm not saying the lower level echelon of the pay scale of people that do different jobs under a hospital roof. We know it goes all the way from the most high-paid surgeons in the world right on down to the guy that keeps the trees trimmed and the shrubbery trimmed and cleans the sidewalks. They're all important. They all do a job, but what I saw that I thought was missing, that I really think they blew it with me anyway. I know they did. They blew it. I just flat told them. I wasn't ugly. When we were talking about this aspect, I looked them right in the eye and I said, you failed me. I didn't actually say you and point to a person. I called the facility's name and I said, failed me on this part. And they did. I think that happens a lot. I hope that it doesn't happen to you. But try to remember this. If it does, try to keep in mind that ultimately it's going to frustrate you. Hey, it's going to piss you off. You know, that's what happens. But try to remember this. If that starts happening and you get totally frustrated, because believe me, I called my son one day. I was so aggravated and I was so frustrated. I said, you know what? I'm almost at the point where I'm ready to say to heck with this whole thing and walk away, which would have been really stupid. But I felt that way at the moment. And my son is so laid back and understands. He said, Dad, it'll all be okay tomorrow. This too shall pass. And it did. And it will. I just hope none of this happens to you. Maybe I'm 1 out of 100 that it happens to. Wow, that would be a really excellent medical machine if it's just 1 out of 100. And it might be. Maybe I was an outlier in that regard. But it was a very frustrating experience. But as far as the professionalism and the outrageously good care and the expertise of those people that are actually in there doing, as I say, the the cutting, the sucking, and the stitching and all that the down and dirty of that procedure, hey, they're out there. It's not just my hospital. I think there's many of them. Because I actually talked to other doctors. I got more than one opinion, and that's something I suggest you do. This doctor may want to do this and this and that before he does the surgery. I had one that did. That's world-renowned. And I said, I don't want that pre-stuff. I won't even tell you what it is, but it was something that he wanted me to do first that I refused to do. You can call me stubborn if you want to, but my body, my life, my decision. The other surgeon did not say, I don't think you need that pre-surgery. I told him the other doctor had said he wasn't going to do me unless I did this other. And he said, well, I'm not going to require that. I don't understand it. He didn't try to diss the other doctor. And I didn't try to diss the other doctor. I just told him what happened. I said, I want you to know one of the reasons I picked you is because you didn't require that. The other doctor that's actually done more than mine had, and it's really world-renowned, wanted this and that I refused to do. And I don't regret the decision one bit. If you want to do some research, it'll pop up. Some of the doctors want certain things, we'll call them certain therapies, to happen before you actually go in for the actual surgical removal of the prostate gland. If you're okay with that, and you do your research, and you're okay with the side effects, which I wasn't, and I would have never, ever been okay with those side effects. I just didn't want to roll those dice. They may work out fine. They may work for some people, but I made the decision, nah, I'm not going to go down that road. Let's just do the simple thing. Let's just keep it simple, stupid. The KISS method, KISS. Keep it simple, stupid. And I don't mean that in a bad way. It's just an old saying that I've heard all my life. Yeah, that's my take on that. But in spite of all of that, the aggravation, the terrible coordination began to happen there toward the end, the frustration that it created because of that. You know, when all that stuff is behind you, you don't think about it. It's over and done with. Move forward. I think that my road ahead is going to be fine. And you know what? If it's okay, and because I so much want guys out there that are having the anxiety right now, that have that in front of them and know that it's coming, that one, they have to make a decision. Who's going to do this for me? What procedure am I going to pick to have done for me? What hospital am I going to pick? How am I going to make all this happen? There's so much coming at you at once that it can get overwhelming. It's tough to keep your head together and be comfortable with whatever decisions you make. I just hope this helps you some. And what I've decided to do is kind of keep up with my progress as it hopefully continues. I believe tomorrow I'm going to be better than I was today. If I'm not, I'll do one saying, well, I went backwards again. Not for sympathy or anything, but just to let you know what could possibly happen. So I will put them up as they progress in real time, so they're not 5 years old when you see them and click on them. I just hope it helps. And I hope in the comments, don't worry about saying anything that's going to hurt my feelings. I'm an old bird. It's tough. I got tough skin. You ain't going to hurt my feelings because I don't care if you blast me. If you want to, that's fine. If you want to watch me, fine. If you don't, just click off. But maybe you guys that are getting ready to face what I face need to speak or hear someone that's been there, done that, because that's what I needed. And I'm thinking maybe there's some other guys out there that need it. So that's why I'm doing this. Hope it'll help. And we'll talk again.